Recording in progress.
Welcome in, everyone. Thank you for joining CarePatrol today. We appreciate you making time on a Friday, which are typically busy days in healthcare, to invest in yourself and share time with us. And I salute you for continuing to seek continuing education hours. We moved to Mondays and Fridays. Thank you for picking up on that and staying with us. We appreciate that. We did so to make room for other presenters of CEUs who are also online on Tuesdays and Thursdays to continue using their calendar. And then we could add to that and give you all 4 opportunities on most weekly basis to receive CEU. So welcome again to CarePatrol. This is a series on new dates or rather days of the week, and we're changing the title because Tuesdays and Thursdays with CarePatrol surely doesn't apply. So now we are pleased to say that we're going to offer care concierge educational services every or most Mondays and Fridays of every month. We're approved by the Board of Social Work and by the Board of Nursing to provide hours to you. Nurses' hours are being loaded to the ABN website this week, should be concluded by next week, and moving forward, all of those hours will be input, after the completion of each certificate. But prior, or of each course rather, but prior to that, we've not had the software to do it. So I apologize, any of you nurses out there who are waiting on your hours to post. They should be posted by the end of next week. Everyone receives a certificate who is with us today, who also does an evaluation. Please remember that our evaluation is code word or password protected. And in order to meet our obligation to the boards of nursing and the boards of social work that say that we must prove that we were here with you live, then we use a survey and a password, which we don't give out until about 50 minutes into today's presentation, so that it's proof that you all were here, we were here together, and we enjoyed our time together. The evaluations are due tonight by 8. I've extended that time because I know many of you, especially on a Friday, are going to get caught up and not be able to get into the system. So the survey's open until 8 o'clock tonight. And the survey address, I know some of you participate by phone. The survey address I will now read for you if you're ready to take it down. It is SurveyMonkey, which is, for those of you who are typically with us, SurveyMonkey. It's https://www.surveymonkey.com/r/ all uppercase letters W, B as in boy, H, B as in boy, 572. So once again, for those of you who are making note of it, who cannot see the screen or the chat room where this is posted, I will read to you the SurveyMonkey evaluation website one more time, and then again, we'll give the password out towards the end of today's presentation. The SurveyMonkey site, for your notes, is https://www.surveymonkey.com/r/all uppercase W, B as in boy, H, B as in boy, 572. So those that's the SurveyMonkey address. Again, it's password protected. And today's teaching is Care Concierge, brought to you by CarePatrol. For those of you who don't know what we do, we are a placement and referral service. We are advocates for our clients. We assess them in their homes or in their rehab or hospital room. We find out what their care needs are and then match providers to those needs. If those providers are private pay and if we have a contract with those providers, then we're paid a commission. That's how we stay in business. We're always free to our families and patients and clients. So that's who we are and how we work. And we've got 5 employees, including myself. They're listed here on the screen for you. Dixie Tyler is in Decatur and serves Decatur, Huntsville, and Coleman. Jennifer Redding is in Florence and serves Southern Tennessee, Florence, and Russellville. Yvonne Eason is in Montgomery and serves Montgomery, Wetumpka, Prattville. And C.W. Merritt is here in Birmingham with me and really can serve the entire state. He's our clinical liaison at CarePatrol, a nurse of 30 years, and can certainly assist you in understanding what are the best needs in the placement world and the assisted living world for your client if that's the world they need to be in. And I know that so many of you don't really deal with assisted livings or know much about them. And so I'm hoping that you'll use us as a resource because we tour them with our clients like a realtor would. So we're in all of them all of the time and can tell you, who left, who's new, how the food tastes, etc. And would love to be able to be a resource to you. But our reason for being here today, as you know, is our educational CEU series, Care Concierge. And we will discuss today, caregiver resilience strategies. And I'll interrupt to say I got an email or message in the chat room from someone who said they've been signed in as someone different. That doesn't matter how you sign in. What matters is whether or not you do the evaluation and leave the correct email in the evaluation. And remember, it is password protected. So our objectives for today are threefold. And as you know, in order to provide a CEU, we need to have objectives and we need to meet those. And I hope when you do your evaluation, you'll be honest with us as to whether or not we've met the burden of these. And so our first objective today, as we discuss caregiver resilience strategies, is to review the backdrop of caregiving in America and the demographics of it. Now, some of you I know were here for caregiver stress syndrome. You'll recognize some of these slides as I'm repeating them, but I do think it is good information to repeat, and I do want to share it with you. And then secondly, our second objective is to list the 5 R's of the caregiver resilience model. And we'll get into that in the presentation, which I look forward to. And lastly, our third objective is to learn the caregiver resilience model for yourselves as professionals. How might you invoke this on behalf of your clients and patients in your clinics so that it might be a benefit to them? So that is the objectives for today. Please do make note of those as you do the evaluation. And remember that it is tied to your email and your license number, which we ask for in the evaluation. So don't worry about anything other than completing the evaluation in order to get credit for this hour. And so the U.S. Bureau of Census and the Centers for Disease Control in 2020, I believe it was, did a study. And what they found was that 1 in 5 Americans, 1 in 5 Americans, 80 million people, live with a disability. 80 million people is about 22% of the US population. And so, again, 1 in 5 people who you meet, who you see, have a disability in America. And almost 11% of them have a disability that is dementia or cognitively related, while about 13% are mobility related. Now, another 6.5% have difficulty with independent living. And what this might mean, in fact, would be someone who is, for the most part, homebound and needs groceries. Well, someone who has difficulty living independently has difficulty getting to the grocery store. They may also have difficulty with, unloading their groceries. They may have difficulty planning meals. They may have difficulty cooking because of a disability. So 6.5% of the 80 million people have difficulty living independently. And about 5% of those 80 million are blind or nearly blind. These are folks most likely with macular degeneration, which is to say these are aging folks in all likelihood. And about 4% can't perform ADLs. And so that 4%, it would be folks that might look at a community placement or might need sitter services in the home or might be receiving caregiver services in the home from an unpaid caregiver. But what we know is that as people, as disabilities rise, and they will rise in relation and in proportion to the aging population, caregivers are needed now more than ever. Now think about it, y'all. We've said this before, but 10,000 people today turn 65. And then tomorrow, 10,000 more. And then the next day, 10,000 more. And a month from now, 10,000 more. And next year, 10,000 more. In fact, since 2009, between 10,000 and 13,000 people have turned 65 years old every day since 2009, and they will until 2029. Now, these people, as they age, will become, many of them, part of these 80 million or a greater number than 80 million of people with a disability. Many of them will have macular degeneration. Many of them will have difficulty, getting out of the house to run errands. Many of them will have difficulty bathing. Many of them will have cognitive issues. And so as these folks age and need care, the burden will fall on someone. It may be an unpaid person, it may be a paid person, but regardless, caregivers are needed today as much as ever and will continue to be needed. This will never go away. Each of you is well positioned in your career to be in your career for as long as you want, because the population is rising, and with it, so are the cases of disability and issues around that. The National Academies of Sciences and Engineering and Medicine also did a survey. And they just sort of broke out unpaid versus paid caregiving. And in each case, you would have someone involved who was helping, someone with ADLs, activities of daily living, and in many cases, medical tasks like, infusions or injections. And then, paid caregivers, we tend to think of as being more like you all, people who are in a clinic, in a healthcare setting, long-term care, a hospital. So, those are paid caregivers. There are many in the home, as you know, with in-home caregiving companies, which are growing in number every day, it seems. But in general, we know that, there are 80 million people who have a disability in the US, and there are 53 million people who are involved in caregiving. Okay, 123 million people, and that's roughly 30% of the US population is either involved in giving care or receiving care. 1 in 3. Now, I want y'all to think about this when you go out in the world today. 1 in 3 people you see are either receiving or giving care. Think about that. That's huge. And I want to ask you, if you're a caregiver, if you're comfortable, identify yourself in the chat room. I'm one. That's all you have to say. You don't have to go on about it. Or if you have an experience you want to share, please do. Or if you want me to unmic you, please do. But this is another change in the CarePatrol educational series, now titled Care Concierge, is that I want this to be interactive. more interactive. One of the criticisms we received, which I'm most grateful for, by the way, whomever it was, thank you. One of their criticisms, and criticisms might be the wrong word. It wasn't negative. It simply said, hey, I miss being, I'm sorry, I forgot where I was going with that. Because I started reading Stephen, Linda, Felicia, thank y'all. It was someone said they missed the live Zoom calls and wanted interaction. So this is why we're having interaction today. And Aisha, my heart goes out to you. Tracy, you too. You see, there are 50 of us, 65 of us on this call. We've already had 6 people present as people who are giving care. All right. In addition to the fact, mind it, y'all, that they give care all day long also, right? You give care at work and then you give care at home. And in both cases, we need to help you build your resilience and your strength and your spiritual resolve to continue on. You know, I thank y'all for participating in the chat. It warms me to know that you feel comfortable enough with us to share, and I appreciate it. Thank y'all all, and please keep it coming. Keep talking. I'd love for y'all to talk even independently of me. You can talk, or I can talk, and y'all can talk at the same time. And so what we find then as we look at the number of caregivers again is that dementia is about 15.7 million family caregivers, 15.7 million people out of a population, mind y'all, of about 350 million in the US, a little less. 15.7 million are in unpaid support roles without knowledge or medical training and caring for someone with dementia. 15.7, 5%, 1 in 20. So again, you may identify, many of you have, and I hope God blesses you in your journey, or did. But many of you identify as caregivers, but just know that when you're at the drugstore this afternoon, or at the ball field, or at church, 1 in 20 of the people sitting around you is likely caring for someone with Alzheimer's. Have grace. Have grace. Now, by age, we know that caregivers tend to vary more than care recipients, because really, for example, about 50% of caregivers are 18 to 49. Only about 15% of people in that same age range are receiving care. And I would expect the majority of that 15% would be children. But the caregivers then are, some of them children themselves. So the National Alliance for Caregiving and the ARP claim that the senior population is more likely to be a recipient of care. We've already addressed this, and it's true. And so the average age of the caregiver for the senior is about 49, and that rings true too, doesn't it? If your parents are in their 70s or 80s, you're likely in your 40s or 50s. It's that rings true, and we know, we've already discussed, 10,000 people are turning 65 today. The majority of my clients who need some sort of assistance with ADLs is 82. Okay. And so in 17 years, the people turning 65 today will be one, most likely, of these 80 million receiving care. And I want to read this comment because I like it. It's from Gail Thrasher. And she said, sometimes people do not have much warning that they are going to become a caregiver. When I took care of an elderly relative, she says, I had 24 hours notice that it was going to happen because they could not find placement for her. So maybe people with elderly relatives should consider what they would do if suddenly called upon to be a caregiver. And that's so right, Gail. And I hope as we talk further today, maybe will give you a little bit of a framework for discussing that with folks, either friends or clients. And so we know with age that caregivers tend to be middle-aged, and that presents its own problem. I'm 55, and if I do a whole lot of lifting, I know it the next day in my back, in my legs, and I'm 55. If I were a 75-year-old lifting my wife every day, it would be a much different story. So the caregiver needs support as much as does the care recipient, given the age of the caregivers. Catherine Cooper, thank you. She agreed with Gail, and that was great. I love Gail's comment, and I love you, Catherine, for saying that you and your family now discuss care. That is so healthy. I'm so grateful. I hope all of us maybe can take from this a discussion home. And by gender, this won't surprise most of y'all. But the Institute on Aging finds that most caregivers are women. In fact, 75%. And that's certainly true for me. When I'm working with aging folks, it's almost always the adult daughter and sometimes the adult son, unless there's a daughter. But 75% of these 53 million are female. And it begins to make you feel, okay, why is there not support? Well, we know things that aren't in the culture aren't supported. And so the fact that it's women taking on this role, I think, means there is less support naturally in the world. And the thing is that women, when they're caring for people, they take more time than men do. So even when you find a good guy, and I find a lot of them, they're just not, we're not built. We're not built, I don't think, to do the intimate things, which is what women do, which is why I think women, you spend more time in caregiving roles, because you do the intimate things, feeding someone, helping someone toilet, or doing toileting hygiene, bathing. These are tasks that a lot of men have difficulty with. And so naturally it's left to women who have worked all day as a nurse or a social worker and come home and work all night and do it again the next day and the next and the next and the next. You all know what this is like. And then we look at race and caregiving. And what we know is that really, however you slice it, really about 15 to 20% of all of us, regardless of race or background, are involved in a caregiving role. But what we see even within that is that those that are more likely to be involved are Black Americans and Latinx Americans. And the Latinx Americans are more likely to be the ones who feel the lack of support. I believe this is because there's a language barrier for some, if not many, not only in terms of receiving and asking for care and setting up a care plan, but all the documentation and bureaucracy that goes behind it. Wow, that's a lot to get through. And so we see that regardless of who you are, what age you are, what race you are, what gender, there are a lot of you out there taking care of other people. And all of you need support in some way or another. And what we want to do, what I hope we do, is to teach you a new approach, a new model, a way to hit at this that may be new for you. And here's the thing I'll say about this and about models in general and plans and systems. I may have said this before to y'all, but my wife and I many years ago did the Dave Ramsey thing at church. It's all about putting, not writing checks or having credit cards, but just taking your money and putting actual cash in envelopes and only spending that. And it teaches you to budget and manage with what you have, and which is a great system. But it's not perfect, and it's not the only system. And in the end, to me, it doesn't matter whether you choose Dave Ramsey's system or Susie Orman's system or someone else's system. What matters is that you have a system and a plan and a course of action to follow. Regardless of what it is or the origin of it, have a plan. So for those of you who don't yet have that plan for helping someone develop caregiver resilience, we present today this approach, which is the brainchild of Dr. Aaron Blight, who is a noted speaker on caregivers and caregiving issues. And he writes that despite the widespread prevalence of caregiving, and we talked about the numbers, they're huge and they're growing, family members assume the caregiver role and then find out that they're totally unprepared, completely. Not just the physical demands, which are toiling, but the emotional demands and the change in the dichotomy of the relationship, the paradigm shift in the relationship, the spiritual injury to that, the emotional upheaval of caring for someone. And what Dr. Blight had said, and the reason he did this research and formed this system and created this plan was that he found that the advice that we give caregivers today is lacking. Again, we talked about a lack of support. And what's lacking is that we even said this when we talked about caregiver stress syndrome. People, when they find out that someone's a caregiver, they'll give them a checklist almost and say, well, if you do these things, you'll be okay. If you do these things and you'll get by, you'll make it, you'll be all right. And we all know those things, and those things tend to be true whether you're a caregiver or working in some other capacity. And so I want to ask you all again in an interactive way, what things you might have done for yourself in the past to provide self-care when you were caring for someone else. And remember, I consider that each of you today are caring for someone else, and probably many someone else's, just in the course of your daily grind. And so your experience as a professional is as meaningful to this discussion as if you were a layperson taking care of someone as a caregiver. So I want to hear from y'all if you've been caregiving for others, or even in your daily life, what self-care do you employ for yourself? And I hope that we'll get some more. I have to make Tito laugh and smile. Who's Tito, Keldon? I want to know. That's funny. As we wait to find out who Tito is from Keldon Jones, I hope. Oh, time to laugh. I thought, was Tito your dog or is Tito vodka? And if you're making vodka laugh and smile, Keldon, let's talk after this. Oh, Tracy, your dog. My dogs provide therapy for me too. I take vacations and stay connected with friends in church. Traveling is, Connie went to vodka too. Traveling is so important. I don't know that you can shirk your daily life quite as effectively as you can if you leave your environment. Leave your home where you're caregiving for someone. Leave the city where you drive to work every day. Go camping in the woods, go to the beach, do whatever it is, go to New Orleans and shop, whatever it does for you. Getting out of your environment does wonders. Jennifer does yard work. I do too, which I like. And the rain lately, I'm just so happy about because my azaleas are drooping. Tracy, you enjoy hiking before the temps go higher than 85. Well, that would be February and November, I think. And gosh, we've got a hot summer. Yes, to retail therapy, Felicia. Thank you. Thank y'all. Thank you for joining us, and keep them coming. I'm going to move on in the spirit of, just helping us meet our timeline today, but I appreciate y'all, your comments. So with caregiver resilience, we know that physically caregivers can take care of themselves using this checklist, don't we? Oh, Paula, I love this comment. She says, if you can find something that you share with the person you are providing care for, it helps. Oh my gosh. My dad and I watch baseball together. My mother and I watch baseball together. In fact, every single night of the week, she texts me, Braves are on. And then somewhere in the middle of the game, she'll say, Yay, Braves, or something to that effect. So while we may not watch it together, we communicate about it. And it does give us a framework and a backdrop against which to have maybe more, bigger conversations. So Paula, thank you for that tip. Caregivers, so we know everybody needs sleep. It's not just caregivers. And everybody needs exercise. It's not just caregivers. And everybody needs good nutrition, indeed, a well-balanced meal. And so when we tell someone this as the prescription for caregiving, it's sort of like we're telling them nothing, because that's the same thing they've heard from every other medical professional they've ever dealt with about themselves. And in all likelihood, they're not minding that advice. And they may not be able to. They may be so entrenched in what they're doing that finding time to sleep, exercise, and eat well just isn't there. We also want for people to ask for help when needed. And we talked about this when we talked about caregiver stress syndrome. It's not enough. Well, it's a big thing, really, to get yourself to the point of accepting help and accepting help without shame or guilt. So accepting help is a big threshold for us, but it's not simply that. We want to be not only open and receptive to help, but actually planning for help. And by that, I mean that we want to keep a list. And it may be a list that we keep in our head. It may be a list that we keep on paper. It may be a note in our phone, whatever, form it takes. We need to keep a list of those things that we need doing. And that list will change on probably a daily basis, certainly a weekly basis. So the next time someone says to you, hey, we've been thinking about y'all, what can we do to help? Please don't say, well, nothing, we're good. Thank you for your thoughts. We appreciate it. We're all fine. Please don't say that. Please say instead, you know what? These library books are overdue and I just can't seem to get away. Would you mind taking them for me? Or, you know what? My loved one's prescription was called in, but they're having a really bad day and I can't get away. Would you mind stopping by the CVS on the way home? And keep a list. And so that when people ask, you can answer. And each little answer, each little task will take a brick off of your back, a weight. But that's not enough. Not enough. We want to develop resilience. And what is resilience, you ask? Resilience is this. It's the ability to cope. Resilience is the ability to cope with difficult circumstances in order to overcome adversity. The ability to cope with difficult circumstances in order to avoid getting overwhelmed. And the ability to cope with difficult circumstances in order to meet the ever-changing needs of the care recipient. So let's look at developing resilience. It won't be easy. It won't be easy to develop caregiver resilience. And one of the reasons is that it's going to involve some uncomfortable topics of conversation. And that's just the short of it. It's going to involve some caregiving tasks you may never have had to do before. And it may involve spending more or less time with your loved one, more time in the sense of time caregiving, less time in the sense of quality time, time in which you're enriching each other just with your company. And so as we adapt, we're going to have to address this awkwardness. And as the person's needs continue to evolve, we're going to have to continue to adapt. We're going to have to continue to make adjustments, continue to review what's working and what's not working, and then make sure that we can meet the needs of that person whose care is up to us. And so changing minds about caregivers is really like changing the mindset is what we need to develop the resilience. So we have to change the whole outlook of the person who's doing care, giving care. And so the way that we do that is that we change how we view caregiving. Most of us will view caregiving as a undoing, a process of decay, a process of dying, a process of becoming debilitated, a process of pain and discomfort and other things. And what it really is simple. Caregiving is life, and life is unpredictable. It comes at us in different ways, and we have to be ever mindful and ever vigilant and ever present when meeting life. We've talked about this in the past, whether we talked about hospice or self-care or caregiver stress. We have to change our mindset, and we have to view caregiving not as a negative, but as an opportunity, not as a challenge or a burden, but as a chance. Okay. And what that is, that chance, that opportunity, is the opportunity to grow and grow in a new and profound way, in a way that you didn't expect, didn't plan, didn't ask for, didn't anticipate, didn't want. And yet here it is. That's life. And so with caregiving, we need to take the same approach that we take to living a healthy life and view each interaction as an opportunity, a chance to make a difference in our life or the life of someone else's. We have to change the mindset of the people who come to us needing care or giving care. Oops. And so the framework that we've developed, not that I have no part in it, that Dr. Blight created for this was the caregiver resilience model, which is his name for the model. And I've borrowed this talk from his work to be fair to him. But he suggests that we develop a framework called the caregiver resilience model to help our caregiving friends and patients and clients and selves, that we give them a mindset needed for the ongoing adaptation that will be necessary for them to continue to care for their loved one or patient. And the 5 domains of the experience of caring for someone, and in really, to be fair, the experience of receiving care, are these in Dr. Blight's model: 5 R's: roles, relationships, realities, rewards, and readiness. And by the way, y'all, I am about to type in both the link to today's survey for those of you that have the chat room up. Well, I'm sorry, I can't, but I am going to put in the password today, which is 5-R, 5R. Roles, relationships, realities, rewards, and readiness. 5-R is the password, y'all. That is the password for today's evaluation. And here's the first one: roles. So if we want to help our client or ourself develop resilience, we need to begin to look at the relationship of the care experience from the perspective of the role play within it. Now, this is something in chapter 2 of Dr. Blight's book, which is called When Caregiving Calls, Guidance as You Care for a Parent, Spouse, or Aging Relative. That's Dr. Blight, 2020, excuse me. It's When Caregiving Calls, Guidance as You Care for a Parent, Spouse, or Aging Relative. So we love to, in these care concierge educational courses, we love to introduce new topics. We love to introduce tools for you and resources. And I think this book, if you're in the caregiving role, would be a great resource. In this chapter, in chapter two, excuse me, as he discusses roles, he cites the work of an Irving Goffman, who in 1959 created a metaphor for the care experience. And the metaphor is this: the care experience is a stage play. Okay? And this may help you or your clients. Part of being able to see things for what they are is the ability to see them objectively and not subjectively. And so visually and in our mental picture, if we begin to view our care experience as apart from us, as being on a stage, as removed from us, we can begin, hopefully, to begin to see it more for what it is in fact, and not what it maybe has become in our mind. Does that make sense? And in this stage play, the star of the show there in front of us is the receiver. And we don't really, in our literature and in our studies and our data points, we really don't talk a lot about the care receiver. We talk a lot about the caregiver, but the care receiver is the star of the show of care experience. They're the star. The script is essentially the medical record. The script is the health condition, the diagnosis, the prognosis, the treatment plan. And we may even be a play that's just being rehearsed in a way, because the play changes. So we may be doing this in the play on one day, and then the next day that no longer works, you see. And so the script is ever changing, but it is not us in charge of the script, nor is it the care recipient. The script is outside of both of us. It's just a thing. It's words. It's a word picture around a condition. It's not the person. It's not us. It's not our experience. But it is the script. And the caregiver, in this metaphor, is the supporting actor. I call that Morgan Freeman. Morgan Freeman's the best supporting actor ever. And he's sometimes a star, true, but he's a great supporting actor and great with penguins. But so you, as a caregiver, you're Morgan Freeman, and the care recipient might be Denzel Washington. Okay, you see the difference? Both of you are important. Both of you are stars. Both of you make the play better. Both of you are the play. But you're there as the supporting actor. You, Morgan Freeman, are there to make Denzel Washington shine, to make Denzel look good, right? To make Denzel well and healthy and able to function and live and be independent as possible. So if we can begin to give people this little metaphor, this little framework, maybe we can begin to help them remove themselves from the situation so they can think more clearly. And I want y'all now, in an interactive sense, if you will, to name some of the roles that you play. Now, these roles aren't limited to caregiver and care recipient. They're not even limited to nurse or social worker. They're not limited to son or daughter, cousin or brother, sister, or uncle. These are all roles. Churchgoer, ball coach, biker, whatever it may be. These are roles that each of us play in life. And the more that we understand that in each of these instances and in each of these interactions, we are playing a role, then again, we can begin to remove ourselves from the emotional attachment to begin to see, okay, what is this situation really like? I thank y'all, Monica and Sarah Ruth. Interpreter, I love that. I'm actually floored by that. Interpreter, that's terrific. And that's what each of you are. Well, thank you for pointing that out, Monica. Each of you are interpreters. You interpret the data about your patients to them in a way that enables them to understand it and repeat it and make decisions around it. You're all interpreters. What a beautiful statement. And Sarah Ruth, you're a listener, lover, giver, Andrea, supporter, Felicia, advocate. These are our roles, y'all. But we're not limited to those. We're more than the role that we play. And in many ways, we're not even the role that we play. It's just the role we play. Mediator. I love that too, Sarah Hunt. I bet we all in our lives, in our career, our professional lives are mediators when we're dealing with families. And you all know, nobody has to tell you, dealing with families can be rough. Some of them make you glad that you're in your family, is however dysfunctional your family is. Here, Connie, social worker, head of my household. I love that. Head of household. What a great role. Dog mom, daughter, mother, grandmother, sister, aunt, friend, comforter, advisor. The list is long. That's right, Connie. And that's what I want y'all to see. The list is long. You're all of those things and none of them at the same time. It's a role. And if we can make caregiving the role, we can approach it in an objective way and in a more effective. Keldon, lion tamer. We need to go out and have lunch, Keldon. I think you're a joker. I like that. Lion tamer, entertainment director, nutritionist, accountant, secretary, family counselor, wife, mother, churchgoer. Thank y'all for participating. I love this. I so much want this to be a space where you feel comfortable and that you get something out of, truly. So thank y'all for that. We'll move to relationships. So if we're going to help our clients develop caregiver relationships, we have to help them realize that it's the most important thing is that the relationship is going to change. This is a reality they must accept. We'll talk about reality next. Their situation is changing. Montgomery and Kozlowski pointed this out in a study in 2012, but the relationship is the most important thing to keep in mind. The actions change as the needs improve, and the identity of the role that we've adopted takes a new stance. So we might have before been simply the person, the role would have been mom's taxi. Now we're mom's bather, mom's barber. So the role change. Kelly, you are funny. So 3 steps to honoring this relationship that we had with this person is this. Remember the historic relationship. Today, you are a caregiver, but yesterday you were a son. And you had a relationship with your father, not a care recipient. Remember that father-son relationship while you care for your father, who will change and maybe become a different person than you remember. And acknowledge that things are changing in your relationship because of your health condition of your loved one, because of the script outside of us and beyond our control. We must adapt to the emerging needs of the changing needs of the loved one, while always remembering, I am your son, you're my father. We respect each other in that way. And then there's realities. And so rather than choosing avoidance or denial, which is what many of us choose, or even more of us choose, staying so busy we don't have to deal with what's going on in our life. If we do not deal with the reality of caregiving on a spiritual, emotional, and physical level, we are going to meet deep distress. And then there are 5 hard realities that we have to share with folks, which is this: bodies fail. Sometimes the treatment is worse than the disease. In other words, this too shall pass. It is bad now, it will get better. Caregiving causes stress. We all know that, but it's one thing to know something. You know this about life. It's one thing to know, yeah, I know caregiving causes stress. But then when you become a caregiver and you begin to not sleep, not eat, lose weight, feel sick, then you have to remember, hey, ding, ding, caregiving causes stress. And then you know caregiving causes stress. They will learn this, and it's better to teach them now. You're going to be stressed. Look for these common symptoms of stress and address them. Can be an emotional roller coaster, and the end of the roller coaster is the end of the ride, death. This is the reality we face as caregivers. Rewards, we'll talk about that in a minute, but y'all know that beauty from ashes is a popular saying, and what we want to do as we look at objectively our role and changing our role and what that role looks like is look for the blessings within that role, within that care experience, in that stage play that's being written by someone else. Okay. And so readiness is to, as we said earlier, adopt a learning orientation to caregiving. View it as an opportunity for growth. Seek information about your care recipient's condition, prognosis, treatment plan, educate oneself, treat it as a fun exercise and getting to know something, the same way you might research grills for the backyard. And then what we see too is that in terms of readiness, if we're adapting a learning orientation, this works with dementia patients, and it may work in all caregiver settings, but we want to show or demonstrate what it is that we want done. We want to use a guessing approach until we find out what's needed. This is when we have people that are nonverbal, of course. And then we want to try with trial and error until we find out what works. And that's the learning aspect of being ready to adapt, being ready to learn, being ready because you're armed with information and education about what might happen, and you have a plan in place for that. And so as we look at caregiver resilience and wrapping it up, understanding the 5 R's, understanding the roles means you're making adjustments to an ever-changing story of caregiving. And it means that you need to learn what it means to fulfill that role play that you have now adopted of being a caregiver, and at the same time, learn the role of the care recipient. And remember that the script is being written by someone else. It is not the care recipient's fault. Honor the relationship so that you are present. We talk a lot about being present. Be present for the important aspects of someone's life, like Paula watching baseball with her father. And while caregiving may change the nature of that interaction, she may also be hand feeding him. They still are on a level that they can, find out some deeper truths about one another. And this motivates you as a caregiver. Confronting realities motivates you as a caregiver. Instead of being in denial, meeting things head on and having, again, a plan in place, acknowledging and accepting and moving forward like a shark. Always keep moving. Cultivating rewards is just, looking for the blessings, looking for the good. This is true in life. You know it. If you ask whether you are a prayerful person or an atheist who meditates, you know that if you ask for what you want, it appears. It may not appear in the form that you asked or in the way that you wanted, but you do bring to yourself what you ask the universe for. And if you ask in your caregiving role for joy and blessings and personal growth, you will meet it. And then practice readiness. So be prepared, have a plan in mind. This is not innate to anyone. You must work at it through practice, trial, and error, like the 3-step process of guessing what someone who's nonverbal needs. And so this is caregiver resilience. We're running out of time, so I'm going to hurry up, y'all. I apologize. I can't put it into the chat, Violet, because I'd have to get out of my. Well, yeah, I can. 1 second. 1 second. Violet has asked me to put SurveyMonkey in the chat room, the link, and I'm going to do that right now. Here's the address I'm putting in. Control C all the way down. Da, da, da. Here is the link, and the password is 5-R. For the professionals, we want you to understand that the 5R model can be a framework that you help to sort of place with the family, place over the family, that can help them build resilience. And the way that you would do this would be through a dialogue with the caregiver and possibly the care recipient. And you frame, prompt, and prompt thinking. So you present this model, the 5R model of caregiver resilience, and you explain it within the context of that patient or family or caregiver. You then prompt them by asking questions that will lead them down the path of the 5Rs. And then you do what you do best as social workers and nurses, which is you brainstorm and you spitball and you dialogue and you interact and you form a relationship with this family and this caregiver, and you create a plan for them, for the care recipient, involving care resiliency, because that's what's going to carry them through. And so it not only helps to create the model, but it allows you to create a shared language in which they can discuss. And this is maybe the reason to have the model, to have the system, is to give you a shared language. It may not be the perfect model, may not be the right language, but what it is it's a shared language that you can share with them, and they can say, well, in the respect of role play and caregiving, I'm feeling this. With respect to readiness, I'm feeling this. So the model you can revisit time and again, adapt and readapt, and lay this over your families and yourselves, and meet resilience and have resilience moving forward, and allowing you to continue to care for those in your charge. As always, thank you for your referrals. I've placed the SurveyMonkey link, which is https://www.surveymonkey.com/r/all uppercase letters W, B as in boy, H, B as in boy, 572. This survey at SurveyMonkey is password protected. You cannot open it unless you have the code word, which is 5-R. And so that's the code word for today. I've given you the SurveyMonkey. We appreciate you, everything you do for us and for others, and appreciate you for being here today. One of you asked about the book, and the book title is, let's see, what slide is that? The book title is, I'm sorry, the book title is When Caregiving Calls, Guidance as You Care for a Parent, Spouse, or Aging Relative. And everyone, if you're new with us today, everyone, when I send out the certificates this evening, you will get not only your certificate, but a copy of this PowerPoint if you'd like to investigate it further. I thank you for being here. I thank you for what you do. Please join us Monday as we discuss Parkinson's, And again next Friday. And remember, we're now Mondays and Fridays Care Concierge with CarePatrol. We appreciate what you do, appreciate you for being here today, and salute you for continuing to look for education to make yourself a better professional or a better person. So again, we're glad to have you here. I hope you have a great weekend. And if I can get this to shut down, I will. Let's see. Well, I'll keep talking, y'all. Here we go. End. Thank y'all. Oh, crud. Thank you, Keldon. I like you, man, or ma'am. I'm not sure if you're male or female.